Bismillah ar-Rahman ar-Rahim. My colleagues and audience, it's my pleasure and my great honor to participate in the 6th annual scientific meeting of International Association of Oral Research and the first virtual international conference that held in Baghdad from the 3rd to the 5th of September 2020. Introduction. The nose is a striking feature of the face. It is regarded by clinicians as the keystone of facial aesthetic, and facial appearance is influenced by the forms of the nose, its relationship with other parts of the soft tissue profile. Some forms of therapy may either directly or indirectly alter the form of the nose and thus facial appearance. Most facial trauma result in a complex forces applied to the skeleton, causing fracture that can be isolated or occur in combination that blur the division between classifications. Patients with facial fracture may be the victim of multi-trauma or have isolated facial injury. Trauma is the leading cause of death in children. Some children occasionally sustain severe injury of the face that require appropriate therapy, and serious maxillofacial region occur less frequently in children compared than with adults. Treatment issues in children compared with adults are also somewhat different owing to the need of ground facial skeleton in children, whereas absolute reduction of fixation fracture is indicated in adults concerned with minimal manipulation of facial skeleton in children is mandated to prevent growth abnormalities. Furthermore, periosteal stripping can affect bone growth and the treatment required is accomplished. The complete construction may adversely affect the growth and development of the face. Surgical treatment of nasal bone fracture in children is a complex and challenging task, not only to maxillofacial surgeons but exceeding also to ENT surgeons and the plastic surgeons. This clinical study was conducted in Ramadi Teaching Hospital at Department of Oral and Maxillofacial Surgery in about 12 child patients with nasal bone fracture, including 9 boys, about 75%, and 3 girls, 25%, were seen at the Department of Maxillofacial Surgery at Ramadi Teaching Hospital. All information regarding age, sex, etiology, associated injuries, pattern of fracture, and treatment options were reviewed and radiographical examination was analyzed. The new maneuver is simple, cheap, and already available at the theater room. It consists of using a bottled plastic fluid bag by creating a design of kidney shape suitable for each individual's patient regarding its length, width, and number of layers. Using a fluid line set to provide a small sleeves of minimum of 1 cm in length to reduce friction of stainless steel wires that will introduce by owl and to prevent unwanted movement that can be taking place during tying of the wire, and it will help in providing good stability and retention of that individualized and new maneuver segment. The wire will pass in a mattress way that it will engage both lateral walls of the nasal bone together. Fractured nasal bone is reduced to its anatomical position with the help of Wilsham forceps, and the dislocated or disrupted nasal bone septum will reduce to its position by Ash forceps. The patient was described cefotaxime injection about 250 milligram, metronidazole suspension, which is called flagyl, of 100 milligram, and mefenamic acid, which is Ponistan suspension of 50-100 milligram, as well as nasofree nasal drops decongestant also can be added for the treatment protocol, and wound care instruction with follow-up visit were given. The septum were removed 2 to 3 weeks post-operatively. The results showed that the age group from 4 years old to 15 years old. Also, the status of the fracture could be either isolated or combined with orbit or zygomatic maxillary or elsewhere. Causes could be RTA, motorcycle accident, fall from height sport, or even others like fighting. Findings, most of common will have deviation or depression or both. Manifestation could be taking place, and regarding facial tissue, it have been divided according to lacerated and non-lacerated. Now we are going to present a clinical case for this new maneuver. This is patient about 12 years old, have sustained direct trauma to the face. The cause for that accident was motorcycle accident. We're now able to see the ecchymosis and the moving of the face with the broadening of nasal bone fracture due to the oedema and hematoma. The X-ray can show the amount of fracture having taken place of the nasal bone, septum, and the lateral walls of the nasal bone. Again, we're able to see the same manifestation by radiographical interpretation on true lateral radiograph for the skull. Now the CT, we show that the mandible is intact, while the fracture on the of the nasal bone have been taken place. Here it's very clear of the lateral wall of the nasal bone. Now the design, as I mentioned, for kidney shape have been fabricated according to the length, width, and the number of layers according to the individual case. So that for larger nose we can provide or fabricate larger dimensions, and for smaller cases we can use a suitable design. Now the bottled plastic fluid have been designed according to the individual case with the sleeving of infusion set to prevent friction. Now under GA, the patient admitted for operation room. Correction of the nasal septum on the lateral nasal wall have been done. The owl have been introduced, which is an amazing instrument actually in the surgeon hands, have been introduced through the lateral walls on both sides in such a way that the design of prefabricated plastic bag have been placed on both sides and tying it together like that, so that we can keep the nasal bone its position and compression of the lateral walls by the two part of the wires on upper and lower to gain matrix wire fixation for that area. Now having proper placed and tying starting on the top of this photo. Now complete tying and with good alignment anatomically for the nasal bone its anatomical position at the end of surgery. Now after 2 days the patient in the ward start the process of healing with the proper medications. Now at the end of the first week we can see the amount of resolution of the oedema and the hematoma. The patient can open his eyes much more comfortably with the resolution and dissolving of the hematoma. This is the lateral profile of the patient, the same evidence. Now, at the end of the 2 weeks, almost complete normal profile and the front view of the patient, and the appliance still in position, with keeping instructions of maintaining good hygiene for the area. At the end of the 3rd week, and now we have prepared the patient to remove the wires. At the end of surgery, at the end of treatment, the appliance have been removed and almost comfortable and aesthetically acceptable contour of the nasal bone. Conclusions. The nose is the most common facial bone that can be broken, and it's perhaps the most commonly broken bone in the human body. Because of the nose, it's the prominent facial features. The broken nose can be dramatically alter the appearance of the person. Nasal complex fracture should be adequately diagnosed to prevent omission of the critical steps in reconstruction, and must adequately and urgently treated, otherwise severe cosmetic deformity will be difficult to correct secondary. As a clinician and as academics, your work without documentation is nothing. So that you have to document your work and to publish your clinical trials and clinical work in almost well-known, high reputation on good standards journals like in Scopus, Web of Science, Clarivet. Like this paper have been published regarding this work of a new maneuver of fixation of pediatric nasal bone fracture, which have been published in the Journal of Craniofacial Surgery. The affiliation of my university have been put in the international PubMed journals and in the international well-known libraries, so that can other authors and colleagues get benefit from it. And finally, my colleagues, thank you for kind attention and listening. Hoping to see you in future conferences.